Hey everyone.
Morning.
Thanks for joining the Health Minister and I this morning here at the Kwinana Vaccination Clinic. And it's great to see so many people here getting vaccinated today. Great sign. Overnight, Western Australia has recorded 2 new local cases of COVID-19. One is a close contact of case 1133, the backpacker, who was at the mess hall and has been in self-quarantine. This person tested negative initially last week, highlighting that the onset of the virus can occur later when it comes to the Delta variant. The other case is a young woman who is another member of the backpacker community. We don't believe she was at the mess hall event, but she has been in contact with some of the people and obviously developed an exposure from some of the contact with some of the backpackers. So just goes to show that being cautious is the right approach. Now, our contact tracers have now identified 704 close contacts of the backpackers. Of these, 92% have tested negative. 54 are still to be tested. Of these, 44 were at the mess hall event. The number has slightly increased as a result of a reconciliation of all the data available. WA Police advise that of the 44 contacts from the mess hall, 16 people are unlikely to be located due to false or misleading information they provided through the contact register or ticket sales. WA Police and WA Health continue to do everything possible to track the remaining people down. We have now identified 1,260 casual contacts. Of these, 82% have tested negative. 204 of these people are still to be tested. We urge everyone who was at the mess hall or any other exposure sites who has not come forward to do so urgently. Testing numbers are these. We conducted 4,352 tests yesterday for a total of 38,165 tests since the 23rd of December. If you're unwell, you've been doing the exposure sites, please go and get tested. Testers are available, and I'm advised the wait time is very, very short. WA's vaccination rate is now 91.7% first dose over 12 and 83.6% double dose over 12. So our numbers continue to grow each and every day. And obviously over this period we'll get further cases further doses as you can see rolling out. Third doses, we again urge everyone who is eligible to get their third dose as soon as possible. Thousands of West Australians are continuing to roll up to WA. As of 5 p.m. yesterday, we had a total of 6,514 vaccinations administered in our state-run clinics. More than half were third doses. That does not include the doctors' surgeries and pharmacies. So the numbers will be significantly higher, therefore our percentage will be significantly higher than that once we get all those figures in. Now, in terms of the third dose, there's currently a 5-month time frame for getting your third dose. I just got my third dose, it was fine. I encourage everyone to go and get your third dose as soon as you are eligible. There's currently 600,000 West Australians eligible for their third dose. As of January 4, as per the advice from the federal authorities, the time frame between your second and third dose will drop to 4 months. Then from January 31, it will drop again to 3 months. So in other words, there'll be far more people eligible for their third dose come January 4, and then even more people eligible for their third dose come January 31. So the opportunity will be there for people to go and get their third dose. My advice to people is if you're eligible, go and get it now. You can make yourself or protect yourself as soon as you possibly can, and you can avoid the rush that will no doubt occur during January as more and more people become eligible. I'll now hand over to the Health Minister to say a few words.
Thanks, Premier. And I want to thank all of those people who've continued to come forward for testing. Yesterday, 4,352 people came forward for testing, and the day before that, just over 5,000. I know it's hot and our case numbers are low, certainly over the last few days, but we can't be sure we're out of the woods until all of those people, particularly at the mess hall, have come forward for testing. So I urge you to come forward. You yourself may only experience mild symptoms or may not get sick from COVID, but others in the community that you could spread it to can get very unwell. So your continued efforts of the community to ensure that we've been able to keep our case numbers low so far. And I do want to say thanks to our hard-working health staff who've spent the holiday period working at our testing clinics and our contact tracing, and to the police for all of their assistance. Tens of thousands of people have been tested since the 23rd. In fact, 38,000 have been tested since the 23rd. This is a significant effort, and I thank you all for your cooperation. But there are still a number of close and casual contacts who are yet to be tested. 54 in total, and 44 close contacts from the mess hall alone. So please, if this is you, please come forward and get tested. You can visit Healthy WA website to find the list of clinics and get tested immediately. Additional exposure sites continue to be identified, so I would urge all West Australians to check the Healthy WA website regularly and follow the health directions if you have been to one of these sites. It's also important to keep up other public health and social measures, washing your hands, keep physically distanced, follow the health directions, and if you're not already vaccinated, get vaccinated or get your third dose like the Premier has today. And please check in using the Safe WA app. On the Safe WA app, our contract tracers are running into some issues with people having out-of-date information registered on the Safe WA app, and people misspelling their names, addresses and phone numbers. Please make sure on the Safe WA app that you have actually put in your most up-to-date address and phone number, and you're spelling your details correctly. This is creating some difficulties with the contract tracing. So we know that most West Australians are doing the right thing, and because of that and the effort of our dedicated staff, we've been able to limit the spread of the virus so far. So thank you all for doing your bit, and I'll hand back to the Premier for questions.
Thanks very much, Minister.
These restrictions that we currently have, are those likely just to sort of roll on until every fight don't get a hold on where these sort of new close contacts start?
Well, hopefully not. We're trying to ensure that we can lift the restrictions as of January 4. So we'll see what the further testing results throw up. Obviously, there's going to be a group of people that we don't actually find because they've either given us false or misleading information. Perhaps some of them have left the state as well, so that often happens. So we don't exactly know where a very small proportion of these people are. So hopefully we'll be able to lift the restrictions on January 4, on Tuesday I think that is, but we'll wait and see what happens.
What's been done to find the close contacts?
Everything. Police are working very hard to try and find these people. So phone calls, checking where they might be living, all those, contacting their friends, all those sorts of things are going on.
Was the information they provided on the check-in app obviously deliberately false in some cases?
It's hard to know. Jess, it's hard to know. I don't think it was that extreme, but obviously, look, some people, these are young people and they're backpackers, so they move around. So some of them, as I said, may well have gone east already. Some may, run out of battery. These are these sorts of things that happen. Others might have provided a wrong number or something like that. Whether it was deliberate or not, we don't know.
Are they in trouble, and would that be deterring them?
No, they're not in trouble. We don't want to proceed down that route. We just want to get them tested. So we're just saying to people, please come and get tested. You're not going to get in trouble. Just do the right thing.
How concerned are you that there could be more positive cases you don't know about?
Well, that's always a concern, but we're in a much better position than any other state or territory in Australia. Over East they have thousands of cases each day. We have 2. So we're in a much better position. Hopefully we can be confident that we've eliminated it by next Tuesday. We can get back to normal, at least for a month, but we'll wait and see.
After February 5, will WA continue to demand a PCR test from interstate arrivals?
Well, that's something that's up for discussion tomorrow at the National Cabinet meeting. So obviously some states don't want to proceed or don't want to continue doing that. We'll listen to the conversation tomorrow about all of that and whether or not the nation moves towards RAT testing as opposed to PCR testing. So That's something that we'll listen to the advice nationally. We'll listen to the Chief Health Officer nationally and also the State Chief Health Officer to work out the best approach. We would like to continue with PCR testing up until at least February 5. We have very few people coming from interstate, so it's not really a burden on other states to do that. I think the bigger issue is people holidaying around the eastern states, going up and down the eastern seaboard, which is putting some pressure on their systems, but certainly Western Australia is not really adding to that because the numbers are so tiny that are travelling from the east to here.
What about PCR tests?
Today banned PCR tests for travel. So does that mean now it's possible to come from South Australia until February 5 and potentially after that if PCR is required?
We're going to work through that. Obviously, if someone goes in to get a PCR test, it's up to them as the reason they give to get their PCR test. I'm not suggesting that at all. It's just up to people in South Australia as to how they go and get their tests. But the numbers coming in from South Australia are very small. We expect it will get even less in coming days because South Australia is obviously heading towards extreme status. So there'll be very few people coming from any of the other states very shortly, at least until February 5.
What about PCR testing on arrival in WA after February 5? That was something that's in the sector.
Yeah.
Subject to review. Is that likely to be scrapped?
No, I think that would be something that would continue. But look, it's a moving feast. One of the advantages of waiting till February 5 is we can see what happens in the other states. I know I got a lot of criticism for waiting. Everyone lots of media and other attacks on us for waiting longer. But the upside of waiting longer is we can watch what's occurred in other states and hopefully learn from what they've done and put in place rules that will hold and work. And what we'll be able to do is calibrate what we do in the lead up to February 5 and the rules post February 5 based upon all those experiences in the other states.
On rapid antigen tests, they're obviously in short supply in some states. I think Victoria announced today they've guaranteed about 30 odd million doses of kits. What's being done behind the scenes, given it seems like this will be the way forward to guarantee WA supply for the client?
We've got massive orders in for rapid antigen tests for Western Australia. We expect we'll have around 8 million by February 5, and we expect we'll get a lot more after that.
So should West Australians expect to be able to get a hold of those?
Yeah, in due course. What you don't want to do is put them out there now and people use them when they don't need to. It would just be a waste of resource. We need to save them for when we need them. And so we'll change our rules on rapid antigen testing sometime in January and make it far more available. But you only want to use it when you need to, and we expect that won't be till after February 5.
Will they be available free? How much is it?
I expect they'll be free, but we'll work through those details. Look, the great thing is we have tiny numbers of cases in Western Australia, and we have time to work through these details, having a look at what is occurring in other states. As you've seen in other states, particularly New South Wales, they chop and change from day to day. Their rules change from one day to another as they try and cope with what's occurring. So what we can do is watch what occurs there and hopefully, bear in mind COVID is very unpredictable, put in place rules that will be based upon best practice, best experience and that will hold and stand the test of time.
What do you make of the Prime Minister's proposed new definition of close contact?
Yeah, look, we're having a national cabinet meeting about that tomorrow. I think that is wise. What you don't want to do is have lots of people just leaving the workforce because they are in touch with someone who is positive, particularly in critical sectors. So you imagine in a power station, someone turns up for work who's positive and then everyone goes off work. Power station shuts down, or a hospital, or an aged care facility. You can't have that happen. So the new definitions, the tighter definitions of close contacts is a good thing to do.
And the isolation period, reducing that from 2 weeks to a week, do you support that?
Look, that's something I'll get further medical advice on, but certainly limiting the number of close contacts I think is a wise thing to do.
Would that be restricted to people who are vaccinated or to certain industries, reducing the isolation period potentially?
Look, I'll see what they recommend tomorrow at the meeting.
Those 8 million tests you're saying you're having on order for February 5, how much does the state already have stockpiled?
We have a large number, but we have contracts in place that will deliver 8 million by February 5.
Just on the 2 cases from today, how long have they both been in isolation for? And that second one wasn't a close contact of case 1,
So,
2, 3,
the first case is a young woman. She was exposed at the mess hall event, and is also a close contact of one of the secondary cases. So she has been in quarantine for a period. She's going into supervised hotel accommodation now, as indeed are her housemates. The second case was a young woman. She was a member of the sort of backpacker community, if you like. She's been in contact with a range of people. So how she's acquired it, we're not quite sure at this point in time. But she says she wasn't at the mess hall event. That's all of the information I have available to me at this point in time.
Was she infectious out of the community, or they doing something?
I've given you all the information I have.
Premier, could you clarify?
Backlash about the extension of restrictions on community, particularly from the arts community, especially about the first cut being allowed to go ahead and news even as arts events being cancelled. Is this a double standard?
No, it's not, and I just want to comment on all of that. We've had the best conditions for hospitality, retail, live music, the arts and creatives over the course of the last 2 years of probably anywhere in the world. And huge numbers of events, functions, parties, dance parties, you name it. Nightclubs have been able to operate, whilst in the East they've been closed, whilst around the world they've been closed. So that's point one. Point two is we've done what we had to do around these events where lots of people are dancing, not wearing masks, in close proximity to one another, particularly the backpacker community, which we know is really quite the concern at this point in time. And it will hopefully only be a closure over a period of around 11 days. That's the expectation. We're going to have a package in place to provide some financial support for businesses that have been impacted. We're working through the details of that. Hopefully we'll be able to announce that in coming days. But it's not a fair comparison, a dance party with hundreds if not thousands of people dancing together, to other events which are seated, in which mask wearing's in place, in which people are required to have seated consumption, in which you're required to provide proof of vaccination. It's just not a fair or reasonable or even logical comparison between the two events.
Why couldn't local music festivals be offered a sit-down option though? Could there have been a...
Have you ever been to a music festival? If you've ever been to a music festival, people don't sit at tables sitting around with seated service of drinks. What they do is they get up and they dance, because that's why they're called dance festivals. So it's not a fair comparison. It's a bit like we're going to allow church services. People will be in large numbers together in churches over this period, or have been in large numbers in churches and other events of that nature over this period. What we've tried to do is stop these major dance events where large numbers of people, particularly backpackers, gather, because that's the highest risk. We can't close down everything. And I know people always try and make false comparisons between events. It's no comparison, dance festivals and nightclubs, to other events where there's seated service and mask wearing.
What about boat parties? We're hearing a lot about people who are arranging boat parties, businesses selling tickets to boat parties where people are dancing without masks on. What's your message about that?
My advice to people is to abide by the rules and show common sense. The requirement for no dancing, except for weddings, is there. I know it might be a bit difficult for some people, but it's only for a short period of time.
Could you clarify the rules for no dancing? Does that apply for people who travel outside of the Perth and Peel region?
The rule outside of Perth and Peel is mask wearing. Look, if you want to get into every nitpick every single thing, no, it's mask wearing outside of Perth and Peel.
What about house parties? Are you worried about house parties on New Year's Eve potentially becoming super?
Well, we're doing our best to come up with a set of rules that will hopefully eliminate any spread of the virus by January 4, so we can at least have a normal rest of the Christmas holidays. If you can compare Western Australia to any other state in Australia, this is the best place to be with the least restrictions, and hopefully we can get back to that. In terms of parties in people's homes, as we've said, we're not going to restrict people having family functions, events at their homes. We just urge people to use common sense.
What events can get pretty loud? Is it not the double standard?
No, it's not. It's mask wearing, it's seated consumption of alcohol. It's double vax requirement for people to get in. It's not a dance party. It's a very different sort of event. If we wanted to, the alternative really was we shut everything down, and we didn't want to do that. So we basically selected those events that have high numbers of people dancing in close proximity, like the Perth Mess Hall event, in which particularly you might have backpackers who might be spreaders there. We've done our best to come up with a reasonable set of rules.
On the vaccine mandate, do you have advice on how many employees you expect to leave the workforce come December 31 because they won't get their first jab in time for Group 2 vaccine mandates to be deadline?
I don't have exact advice on that, but the experience has been we get to over 99% vaccination. So with other workforces, we get to over 99% vaccination, which is pretty good. And that ensures that we can be very highly protected before such time as we open borders on February 5.
Do you expect it to have much of an impact on the economy? People leaving?
No, I don't. The much bigger impact on the economy is if we don't have people vaccinated, if industries close down, if hospitals are flooded with unvaccinated sick people. It's far better to get people vaccinated, even though I understand there are people out there who don't like it. And the reality is governments have to lead, we have to do difficult things, we have to put in place rules that work. We know these rules work.
Given the new cases today, there's no chance of a last minute reprieve.
I couldn't hear you, mate.
Given the new cases today, there's no chance of a last minute reprieve for New Year's Eve, I imagine. If there's no new cases tomorrow and on December 31, allowing
No, the rules are in place to Tuesday morning.
With regards to the back company,
The thing about it is, I know, we get attacked for having low numbers of cases. That now seems to be the attack. We're getting attacked for having low numbers of cases. I actually think having low numbers of cases is good, and it shows our measures have worked, and our contact tracing and our communications and our mask wearing and everything works. And so what we're trying to do is ensure we can continue to have low numbers of cases and hopefully no cases, so that for January and early February we can have a very normal Christmas holidays.
what will happen post-February 5 though, and not noting that it's up for discussion of National Cabinet that tomorrow, that if the 14-day requirement remains even for vaccinated close contacts, that would result in workplaces, schools, hotels, hostels constantly shutting down, wouldn't it? So if between cases are identified.
Well, that's what we're trying to avoid with the close contact definition. So the close contact definition put forward by the Prime Minister, which we'll get further information about tomorrow, is essentially around families. So if you're in a household with someone else who is positive, you are a close contact. Just because you happen to share a workplace with someone who is positive does not make you a close contact. So that's the definition that is being moved towards. Now, I've had conversations with premiers in other states who are advising me, and in fact I had a conversation with the Prime Minister yesterday about it. The close contact definitions as they're currently in place are crippling all sorts of industries, especially essential industries in the eastern states. So if you come up with a definition that is rational and reasonable and workable, you can ensure that people are kept safe, but also major industries, especially hospitals and aged care and power stations and essential retail and the like, are able to continue to operate.
What did you make of the case numbers in New South Wales today?
Sorry, James?
What did you make of those case numbers in New South Wales today, over 11,000?
Well, they're very high, very high. New South Wales, you see, the good thing about watching New South Wales is you can learn what not to do. And so they've chopped and changed on masks, they've chopped and changed on everything really. And so by watching New South Wales, you can see what works and what doesn't work. Generally what they do doesn't work, so you operate on the basis, don't do what New South Wales does.
25,000 daily cases by the end of January in New South Wales and others like does that change your thinking on February 5 now? You're still committed to that?
The main thing is we have to get people vaccinated. February 5 was based upon getting people vaccinated over 90%. We'll clearly make that by February 5 because we're at 91.7% first dose over 12 now. So by February 5, we'll be well above 91, 92, 93% double dose. But we also need to get third doses out there. So I just want people, please go and get your third dose. It's essential, particularly for older people, to protect you from Omicron. When you're eligible, go and get it. Don't delay, don't procrastinate. The opening of the border is set for February 5. You don't want to be a person who hasn't had their third dose on that day.
What kind of dose coverage do you have in mind? February 5?
We're trying to get as high. Look, most people will be eligible by then. Our clinics are here. We're keeping everything open. All our clinics, all our opportunities to get vaccinated. All the pharmacies and doctors are there for this to be done. Kids can be vaccinated from 5 to 11 from the 10th of January. Please go and get it done. Don't delay.
What kind of caseload would you be comfortable with on Tuesday being able to install those restrictions?
It'll depend on the health advice. Hopefully it'll be zero.
Why was not all fire station hospitals specifically declared high risk and everyone put in quarantine when some of them were in contact with the positive case there and other hostels where there are backpackers who are were not?
From memory, it was because there was a group of backpackers from the Fremantle hostel that went to the Messwell event en masse, as in 100 or so of them. So that's why that one was treated the way it was.
Just going back to check-ins, obviously there are some people who haven't provided the right information and that's now causing concern. Are you considering changing anything around the way people are checking in? Are you relying on people to do the right thing, or are WA Police going to be doing more?
We can't have a police officer at every cafe, restaurant, bar, pub, nightclub event in Western Australia. We simply can't. So we just do our best using QR codes, using people's innate common sense and decency to ensure that we get as many people checked in as possible. For what it's worth, what I've noticed in particular over the last week or so, lots more people using the QR check-ins, lots more people doing the right thing. Obviously, when you have cases in the community, it elevates people's awareness, and that means that people do the right thing. So just urge everyone, continue to do the right thing.
How do you feel after your booster shot today? Is it your first Pfizer?
This is my first, that's right. I had AstraZeneca the first two, now I've had Pfizer. I feel fine, and I'm a strong supporter of modern medicine, and it's saved countless millions of lives throughout the years, including mine. So please, just go and get vaccinated when your turn comes, and especially your third dose.
And have a message for parents, especially in Collingwood, who are nervous at the moment as a result of the attack on the 7-year-old.
Well, I don't know all of the details, obviously, but I spoke to the Commissioner about it. He told me it was a terrible event. So obviously all our thoughts go to the little girl and her family, and just urge everyone to make sure your kids are kept safe.
Just on Rottnest Island.
And police, by the way, police are doing everything they can, huge effort, to catch the perpetrator.
Have you received any briefing as to whether it's now believed that it was random or targeted and reflected the community pretty terrifying?
Yeah, no, the police commissioner told me broad details this morning, not specifics, but police are doing everything they can to find the perpetrator, and I just urge everyone, particularly in the northeastern suburbs, make sure you keep an eye on your children.
Just on Rottnest Island, there was a redevelopment of the lodge announced. Do you know if that will take into account the Aboriginal prison history of the area, including the adjoining quad prison cells?
I think it does. So this has been something we've been seeking for a period of time. Obviously, improving the accommodation options at Rottnest will mean more West Australians can enjoy it, and it also alleviates the pressure on some of the more affordable accommodation, so more people with modest incomes can go to Rottnest. So it's a good thing, but it will take into account the heritage and history of the area. Some of the naming, some of the processes will certainly take account of some of the awful events that took place in proximity to the lodge.
Apologies, just on New Year's Eve again. Why does Gloucester Park go ahead with no vaccine requirements and vaccines required to protect customers?
Look, I don't know the details of what's happening at Gloucester Park, but there are a range of events. There's fireworks events, there's a whole range of community functions that are occurring. I know the narrative is that New Year's Eve has been cancelled. Nothing could be further from the truth. New Year's Eve is still going ahead. Events are still able to operate with masks and with seated service. Major community events outdoors are still able to proceed. We recommend mask wearing, but it's not mandated. It's a whole range of events we can't put in place, tests on who can go in because they're outdoors. So lots of these fireworks and other events are still happening. So I just urge people, be sensible, show common sense. You can still enjoy New Year's Eve. No dancing for obvious reasons. I've explained that a number of times, but the reason behind it is the Perth Mess Hall event shows those events can be super spreaders. So let's just enjoy let's just enjoy New Year's Eve, enjoy it safely and responsibly, and I'm sure we'll have a great time. Thank you.